I want to change the subject only because this is extremely important, I think, to everyone. I understand that in September, the SCHIP program for uninsured children will expire. And I'm wondering if you have any ideas about how we can make sure, well, obviously to be politically active ourselves, but I wanted to also have you include your ideas about the underinsured and the uninsured for health insurance in our country.
Thank you. Children's Health Insurance Program. CHIP is the Children's Health Insurance Program. S stands for state, so it's the part of the Children's Health Insurance Program that's administered by the state. Most of the money from that comes from the federal government. It's an extraordinarily important program and is proven to be successful where it is funded. The biggest problem that CHIP and SCHIP have always faced is chronic underfunding. There's no doubt that it works. It makes for healthier children, which makes for healthier adults. It improves our economy. It improves our education. When children are healthier, they can learn better. And in the long run, I deeply feel it decreases our healthcare costs, because when you have healthier children, they become healthier adults. And so it's an extremely important program. It's not completely unrelated to the war in Iraq, because as I just said, when you're spending $10 billion a year outside the country on a war in Iraq, you're going to have a lot fewer resources to do other things with. And so when renewal and expansion of the child health program came up before Congress, the Democrats, House Democrats in the majority, felt that there needed to be certain ways to pay for it. And one of the ways they paid for it was they looked at a program called Medicare Advantage. Medicare Advantage is a program that purports to help Medicare patients by filling in the gap, but it's all administered through private HMOs. The Democrats felt that these private HMOs were getting too much of a subsidy, if you will, and that some of that could be used for children's health care. That is the reason, and you can go ask him, so I don't mean to mistake, but that is the reason why our current congressman says he voted against it. I don't believe that that's a good enough reason at all. And in the long run, I think that we're going to need to have truly Medicare for children, which would do everything SCHIP does and hopefully